The state has to take lead. The leaders who are here have to take lead that we do things correctly.
Thank you. Now we'll ask Dr. Suri. On one side, we say that maybe the labs in our country must have some sort of a grading or certification or accreditation, actually, and other side, the affordability and the cost. So what are your views about as far as the cost is concerned? Because we, on one side, we say that everything should be available and accessible to each and every citizen of our country. And on the other side, actually, the cost is a big factor. Everything revolves around money or dollar. So what are your views on that?
I think I'll start with what Dr. Chaudhary has said, and I think I agree with him 100%. We totally lack regulation in this country for laboratory medicine. We totally lack. Not from today, from all the time. When I started my lab, I thought I am MD pathology and I am CI. So that was the thing I thought was good enough for me. And I started my lab. It was my conscience on which I worked and did. But there are all types of labs in this country, as Dr. Chaudhary has described. And that is the first thing. And that has to come from the state, or the leaders, or from us probably, that we tell the state that you need a regulation. It is very late in the day. But still they found that the reports which they were generating were not up to the mark. And in 1988, they introduced Clinical Laboratory Improvement Act, that is known as CLIA 1988, in which the emphasis was shifted from the qualification of a laboratory personnel, which was there in the regulations earlier, to the processes of the laboratories, the accreditation, as Dr. Chaudhary has said. And there was external inspections and regulations by the federal authorities. And the result was that large number of small labs had to close down because they could not cope up with the regulations, which were very stringent. The pattern of laboratories there were different. There were corporate labs, there were hospitals labs, and there were physicians' office laboratories, POLs. There was almost equal distribution before CLIA, but after the CLIA, the number of hospital labs also shrunk, the corporate labs increased, and the POLs became less in number and less in scope also, because they were only doing those tests which were CLIA exempt, or maybe very basic tests. With the tests with difficulty index, they were not able to do. So there is a strong need of regulation. It's already too late, but never mind. There should be regulation in the laboratory medicine in India. That is one thing. But in India, there is another aspect. There's a different class of labs. Here, there are standalone pathologist labs, unlike other countries. Now, they also will find difficulty because quality control, accreditation, regulation will cost a lot more. And maybe they will either have to grow up or merge, make group practices, or they have to close down. So this is what is likely scenario after the regulations. And second question is regarding reaching to the poorest of the poor. That is a big problem because we can say, okay, we have grown 20%, 30%. Dr. Lal's lab has started doing, instead of 1 million, 10 million tests. But if it does not reach the poorest of the poor, or the poor people who cannot afford, as he says, Dr. Kumar says, that 70% of the people cannot afford. I think two things have to be done, and they are beyond probably laboratory medicines, and that is reforms in all aspects, reforms against corruptions, maybe cost have to be cut down so that it reaches economic uplift of the people? I do not know really what we can do, but we need to do. If we cannot keep people healthy, the people who are healthy are absolutely exposing themselves, and the conditions like tuberculosis, AIDS, malaria, and other infectious diseases, non-infectious diseases will keep bothering the nation. We have a momentum of growth, about 10% growth in general, 9 to 10%, and this momentum will continue for next decade, I'm sure. And we will be a country to reckon with. And we will have gross national products which can compare with the West. But if we do not have reform, our poor will remain poor, and that will be a big problem. If we have reforms, our education standards, our population which are poor, who cannot afford, will grow. So reforms are needed.
Now I'd like to ask actually Mr. Bahl, who is the chairman and CEO of a private medical center, that is a Nova Medical Center. I think this is a big challenge before you that on one side the customer who has become, unfortunately to the patient we are started calling customer, no? So he is aware about his rights, and because of the Consumer Protection Act and RTI and so many legislation are there. The Clinical Establishment Act, which is coming, which has already been approved. And I was watching that debate, which went late in the night. Everybody had an apprehension that we are going to have a closure of so many healthcare institutions in the country. So what are your views regarding that?
Okay. In general, if I say, till the time we are providing the right type of care, like we are into the daycare surgery, which is a very new model in India. But I'm sure, most of you are doctors. We are not trying to do anything which is clinically new. We are trying to do something which is clinically done across the world. US has 10,000 daycare surgery centers. In India, when we looked at the market a year back, we realized there's a lot of daycare surgery work which happens inside the hospital, but not in a standalone setup. So that's what we thought and started doing this. So I call it some kind of innovation where we didn't change anything on clinical quality or practices, carved out a piece where, some kind of surgeries can be done in daycare environment where the patient can come in the morning and leave in the evening. And in last 14 months, close to 2,000 surgeries have been done. And I would say that all have gone well as they would have gone in any super specialty large hospital. Now, coming to the regulatory compliance and RTI, I feel till the time, and it's true for labs or daycare center hospital, till the time patient or customer, till it is service right, both commercially and clinically right, I don't think we should worry about it. See, as Dr. Suri said, he has started a lab 31 years back. It's because of self-regulation he brought it to this level. And now with large corporates, SRL coming, Dr. Lal Path Labs, Metropolis, they also have taken that regulation to a different level of corporate governance and all that. So I personally feel we shouldn't worry till the time we are doing the right thing and charging the right fee. The problem comes for all those unregulated, I liked one word which Dr. Chaudhary said that there are some labs which may be unregulated but still are doing good work also. So typically it depends a lot how do you create the framework. In India today there are no regulation for daycare surgery. And in fact we have tied up with the NABH who has taken a lead and they're launching the standards for daycare surgery standards. So we realized that till that time how do we make sure, so we got the most eminent surgeons to work with us. We know that surgeons who have been doing these surgeries for 20 years, at least they will not do any mistake. Or they will not cut corners on clinical systems or any kind of patient safety factors. So I would say that self-regulation is very critical and one has to be very conscientious of the fact that here we are touching lives. Anything we do in healthcare, whether it is a device manufacturer or a cardiac surgeon, every time something is done, it touches a life. And till the time we are conscious of that fact, we shouldn't be worried about that. But of course, it is critical, the scale and size with which we are all growing and the way patient knowledge is growing. Today, when a patient reaches to any doctor, any lab, he has already Googled through various sites and he knows that what's going on. So to satisfy, it's his desire, and I think it is his basic need now to satisfy him. If we don't bring in this framework quickly up and running, then the challenge lies for us in terms of scaling up. That's the only trade-off we'll have, that we may not grow as fast. But moment government takes a good role in terms of creating those frameworks, we'll have our own advantages there.
Another issue actually which comes actually that though in our country still the health insurance sector has not come that way which is expected, and I'm sure that in coming time actually it is going to take up that place. On one side, if customer or if I want to go and avail the facility in a nursing home or a private center or diagnostic center, I will always look for that the hospital, the lab or diagnostic center or nursing home should have some sort of a quality certification.
Yeah.
Because I know that it is going to be paid by third person actually. Then why I should compromise going to a facility when I am already insured or third party is paying for me? And that is another thing actually where I think there is going to be competition among the nursing homes, hospitals and diagnosis centers to go for the certification. So otherwise they will be away actually from this actually competition actually. Now recently actually we did one study on the system of empanelment of diagnostic centers and nursing homes on the CGHS. This is a study which was done by us in our department actually. And what we projected to the government that why there should be a single pricing for each and every hospital. Maybe a hospital which has got ISO certification, they are spending money for the quality systems. And why they not be? And I'm happy that the government has approved the outcome of that study. So what are your views, sir, Dr. Chaudhary, would like to say on that?
Absolutely agree, sir. I think I'm really delighted that the government requested you to be on that task force because I think the public sector pricing in any country, and I'm not just saying about India, if you go and ask National Health Service in United Kingdom or any other health regulator in the world, state, how much does it cost to do a certain test? 95% possibility they would not know the answer. So they've never calculated it. They had no need to calculate it. It was all funded through a separate budgetary process. It was derived out of a different motivation. So there is no cost reference to begin with. And we noticed that in the H1N1, when Honorable Health Minister announced that it would cost 10,000 rupees to perform a test, and the organized sector said, no, it doesn't cost that much. It costs less than 4,000 rupees, and all of us were in the market with less than 4,000 rupees. And half the time we had to explain to the journalists that how did the minister get that figure of 10,000? So we don't know. But what you're saying is very right. Today there is no premium for certification, accreditation. In fact, it is a cost that increases your cost of test, but you get absolutely no compensation. Now, a patient or a customer, which is actually not a very dignified name for a patient, I absolutely agree. I read very interesting comment that by definition, a customer is an impatient person.